Botox is dangerous. Botox can kill you. Botox will make you freeze and you won't be able to unfreeze. Once you start, you can't stop. It's painful. It's horrible. It makes you crazy. There's no long-term proven benefits. What could happen to us in the future if we keep using Botox? All of these and many of these unanswered questions, all for your viewing pleasure. So tonight we're going to talk about... Oh no, Tracy says. What about these terrible effects of Botox? I was asked to talk about this tonight because I guess there's been a lot of Botox bashing going on. And, you say Botox, but you really mean all neurotoxins because, as we'll point out in a little bit, they're pretty much all exactly the same in terms of the active ingredient. The part of the molecule that does the work is the same in all four molecules. And I'll talk to you about that before. But we'll have a little contest tonight. And whoever comes up with like the craziest, but it has to be real, like no making stuff up. But like the craziest question you've had from a patient or the craziest objection you've had from a patient as to why they don't use Botox or why they're afraid to. Whoever comes up with the truest but craziest, fear from a patient, I'll give you a $50 gift card, and it's really extraordinarily, I'll make it $100. So the challenge is on. And we'll collect that from my office. Man, we're getting a lot of excellent. Kate and Jolie Med Spa, good to see you guys. Dime Aesthetics, good to see you, Marty. I'm not Marty. Cassie. I kind of call you guys the same because you're so close. So yeah, we're talking about what is it about Botox that people are just bashing it. It's dangerous. We don't know the long-term effect after 20 years, really. Thanks for telling me that. Once you stop, you can't. You'll never be able to freeze again. You'll be frozen forever if you use it. The exact opposite. So let's talk a little bit about it. And also, if you have any of these comments that you've encountered, let me know what they are. And whoever comes up with the funniest but truest one, I'll give you a gift card. So let's go with the frozen one. So toxic long-term effects. We think Botox is toxic. And we don't know the long-term effects. So I guess after 20 years and several gazillion treatments of patients, that we still don't know the long-term effects. Well, I don't know if there's been any drug in history that's ever been used more than Botox. And you think that if there was even a slight hint of it being toxic or having negative long-term effects, I guess it depends what you consider a long-term effect. If you die at the age of 90 and got Botox once in your life, can you say your death was Botox related? I guess, but not really. So I think that is kind of a really weak one. I think that's a very weak one because I believe a safety profile has been established. If after 20 years it's still on the market and its use is going up every single day, and if people were seeing complications and problems, they would pretty much stop using it and patients would pretty much stop coming. So I don't give that much credibility. Number two, it gives you a frozen, expressionless look. Yeah, if you want that, you can get that. You don't have to have that. You can customize and titrate your Botox. So there are patients who do say, hey, look, I want my forehead to look like a sheet of glass. And if it doesn't, I'm coming back. And you have other people who say, I really don't want a frozen look. I really want a natural look with some motion. So you, or all of us as providers, have the ability to titrate the dose, right? We give more to people who want a frozen look and less to people. Hello, Deluxe Bar. Good evening tonight. We're talking about, like people, all wives' tales and urban legends about Botox and neurotoxins and how they're bad, all these terrible things you do. And whoever comes up with the best real but funny complaint by a patient or objection by a patient gets a $50 gift card. So we have the ability to make people frozen or not frozen. So it isn't a one, as soon as you get a drop of Botox, you're frozen and you can't move and you can't talk and, you're like a mummy. So not true at all. Kind of a pretty weak one, I think, as well. Also, what's the next one? If you stop, it gets worse. So let's think about how do we get wrinkles. So wrinkles are formed when our skin, which is attached to muscle, follows the muscle. So when a muscle contracts, it shortens. When the muscle shortens and the skin's attached to it, something has to happen to the skin. The skin has to fold too. Just like if you took a piece of paper and shortened it and opened it, you're going to have some wrinkles. And every time you shorten it and lengthen it, you're going to get wrinkling. Every time you shorten the muscle, the skin's attached to it, it wrinkles. I kind of needed that piece of paper. I shouldn't have done that. I can still read it. Okay, never mind. So that's what happens. So if you stop the muscle from contracting and relax it, the wrinkling stops. Unless it's too deep, like mine are already too deep. So how can they get worse? If the muscle goes back to the way it was, then you're back to where you were. It's no worse. It's no better. So not a really good one. I don't think that really holds much water either. If I do Botox, it'll erase all my wrinkles. Well, hopefully that's the goal. Like, why would you do it if that was a problem? If you don't want to erase your wrinkles, you simply don't do Botox. And if you don't want to wear a mask, simply don't wear a mask. Or if you do want to wear a mask, but everyone else isn't, you're welcome to wear a mask. So knock yourself out. So if you don't want to erase all your wrinkles, don't do Botox. If you do Botox. So I don't know why that's so hard. Botox is very painful. Life is very painful. Day-to-day existence is very painful some days. But, pain is really not a big issue with Botox, particularly if you're using a 33 or 32 gauge needle and you have, an experienced injector who understands how to inject it in a reasonably painless fashion. I mean, it's probably the least painful needle injection you can possibly get to your face. I mean, simply said, 32 or 33 gauge needle anywhere in the body is about as, least painful as you can possibly make it, as opposed to an 18 or a 25 or any other size needle. And also, the most painful part of the face is the mid portion of the face, right? That midline, lips, nose, glabellar area. Once you're off the midline, not so bad. So if you think Botox injections are so painful that you can't do them, you probably shouldn't. Honestly, you probably shouldn't do them, because if you can't tolerate that, I can't imagine you having a baby or having a real injury or falling off your bike or what. So probably not for you. Once you start, you can't stop. Yeah, that's the big secret. That's the big secret. It is an incredibly addicting problem, and probably more addicting than opioids. Let's just be honest about it. Once you get that first injection, you're never going to be able to stop, no matter what. Even if you run out of money, you'll probably rob people to get money to do Botox. So that's a real one. That's a true one. So, people have actually really said these things. These are real reasons that my staff researched and found, like in chat rooms in different areas. And they set this up for me to address. And I'm addressing them, but I think these are all kind of, does anyone have a better one, a really good one? Because whoever comes up with the best one, we're going to give a $50 gift card to. Sid Lambert, one of my usuals, one of my regs, one of my posse guys here. I'm not really digging that one. So let's talk a little bit about what is Botox, because my staff was saying, there are lots of injectors out there who, are not particularly experienced. And when people come up with these like outrageous, outlandish, it's unnatural, it shouldn't be put in your body, kind of things. How do we as providers respond? How should we respond? And so they presented me with this tonight. We give them some backup, debunk all these crazy, I don't even want to call them theories. I think crazy objections is the best term I can come up with. So what is Botox? Well, Botox is a neurotoxin, right? It affects the nerve. It gets taken up into the muscle, but it actually works on the nerve. It gets taken up into the nerve, and it affects the way the nerve transmits impulses. So it's sort of like it temporarily prevents the nerve from discharging acetylcholine. So men shouldn't get Botox because their skin will become saggy. Yeah, so they're saying it's okay for women, but it's not okay for men, because men's skin is much thicker than women's. It has much thicker dermis, which makes it much less likely to sag. So you're saying it turns men's faces into women's faces? Like, it thins the dermis? Like, it does something to men that it doesn't do to women? Like, that's just a man who's afraid to get it. You know, and most men are, I guess. I don't know. So yeah, I'll give you like, so far you're the best one because you're the only one. But if anyone else comes up with one that's even crazier than that, but I don't know how you could even say that because it works the same way in men as in women, as far as I know. So not a real, logical one. So yeah, so it gets into the nerve and it prevents the nerve from discharging ACH. So basically, it's like someone took a knife or a scissors and just cut the nerve and it doesn't work anymore. So the muscle gets flaccid and it stops working. But again, my patient, only treat my glabella. I don't want you to treat my forehead. Look how bad my wrinkles are since I saw you, 6 months ago. So only treat my glabella. I don't want you to treat my forehead. Look how bad my wrinkles are since I saw you 6 months ago. So they're saying that since you treated their forehead and their glabella, and then they stopped doing it, the wrinkles in the forehead are much worse. Always happens, right? This always happens. Well, obviously they were never really looking at their forehead. They were looking really only at the glabella, right? So when you made their forehead nice and smooth, they kind of just, this is the way it usually is. And then once it wore off, they were like, oh my God, they were horrified because now they suddenly realized how wrinkled their forehead was. She needed a treatment 3 months earlier, exactly. So part of this is just education, and also part of this is some photographs, right? Photographs just showing that, in fact, your baseline was a wrinkled forehead, and when we treated you with Botox or whatever neurotoxin you choose, it got better. And now you're really noticing it because you actually lived for 3 months in a wrinkle-free world and you liked it. And now you're just, hey, Kate, congratulations. I saw those beautiful wedding pictures. When they argue dosing with you and say 20 units is too much in the glabella. Yeah, because they're usually rocket scientists who say that, who've done a lot of research and are trying to teach you a little bit more about Botox. They're trying to teach you how to be better. When they say it doesn't work, I say it did. Let's look at the... Yeah. So, those are tough patients in a sense because they think they know more than they really do. And those are people in life who think they know more than they really do are always dangerous, I think. And especially when they're telling people who know more than they do that they know more than they do. Not a good thing when they say it does. Yeah. So, unfortunately, there's really not much you can do except educate them. Right? And the education begins with, let me just explain how it works and what you do and what you're seeing, because I've seen this over and over again. And sometimes they don't believe you. And in patients like that, like I saw a patient today who said to me, you were treating me at a certain dose. And last time I was here, you upped the dose and it was too much. She said, and I said, she said, no, it wasn't your fault. You did exactly what I asked you to do. You did exactly what you deviated from what you usually do. And you did exactly what I wanted you to do, but it was too much. I said, well, thanks for not blaming me. It was worth a try. He wasn't angry or anything. We went back to the previous dose. But, I guess maybe I was at a point where I didn't want to argue. And you want to be in our video? Should I let her in the video? Should I let Jolie Metzboner? Let's see what she does. Let's go live with Jolie Metzboner. Totally unprecedented, but we'll do this. It was just 10 units. When I explained I could not, she got mad. Hello.
Hi.
How are you?
I'm well. How are you?
Good. You asked to join, so I'm letting you in.
Oh, thank you.
What do you have to say?
I'm just getting ready to start practicing.
Congratulations. So
Thank
this
you.
is good for you. This is good for you.
Yes.
I've heard people say Botox will leave you expressionless. Yeah. It will if you want it to, right? It's all about dosing. So yeah. So my staff thought this would be a good time to talk to people who are just getting started like yourself. And you'll encounter some of these crazy questions, or not even questions, but like statements. And I've heard this and I've heard that. So we're here tonight to try to debunk some of those myths.
This was actually an accident. I didn't mean to do this. I'm listening in, and so here I am.
Well, good. So now that you're here, have you heard any of these crazy myths or any of these crazy people getting Botox?
Yeah. People are afraid of it. People who don't know what it's all about. They're just afraid of it, and you just have to kind of give them education and
that's
be
exactly
conservative.
It's education, and it's being persistent, and it's sort of saying, you know, as an educated professional, let me just tell you the way it really works. And, you know, I know there's a lot of stuff out there, and you may have fallen prey to some of this crazy information. And just be straight up with them, right? So the other thing I wanted to talk about was like the difference between Botox and all the other fillers, all the other neurotoxin, Dysport, Xeomin, and Jeuveau. And the fifth one that Revance is coming out with, I think, probably in the next, you know, few months. There's a lot of misconceptions about neurotoxins. There's a lot of misconceptions about how different they are, right? But essentially, the really most important part about it is they're really very, very similar. And if you look at all the molecules, so let's say these 4 molecules that we're talking about, 3 of the 4 molecules have a core, 150 kilodalton core, a small chain and a big chain, and they're surrounded by complexing proteins. It's like a little nucleus surrounded by these proteins. And one product, Xeomin, is just a naked neurotoxin molecule. It's just 150 kilodalton nucleus with no complexing proteins.
Right.
When you take Jeuveau, Botox, or Dysport with their complexing proteins and you add saline to it and you swirl it up a little bit, the complexing proteins dissociate. They're not even connected anymore, and they don't get into the nerve, right? They're not taken up by the nerve. So in Jeuveau, Dysport, Xeomin, and Botox, the only thing that gets into the nerve is the 150 kilodalton nucleus, which is exactly the same in all 4 neurotoxins. So my question to you is, how different can they possibly be?
I don't believe that they are.
They can't be, right? So what's different, right? If the complexing proteins dissociate and break down and they haven't been shown to affect longevity or onset or diffusion or any of these things, what is the thing that makes the difference? And you're looking at it. Look in the mirror and you'll see what makes a difference in your neurotoxins. It's dosing, it's dilution, it's how you inject it, it's where you inject it, it's knowing the anatomy, it's superficial versus deep. It's us. Like, we're the variables. The neurotoxins are the same. But if we think that one spreads more than the other, or if we dilute one more than the other, or if we hyper-dilute one, whatever it is, we're affecting all of the things I've talked about. So we are the variables, right? From one injector to another, you'll see differences. It's not the neurotoxins, and it's what we kind of think is happening that forces us to change our dilution and change our injection pattern, and maybe not knowing the anatomy in one area as well as the other. So if anyone tells you that there's a dramatic and proved difference among these neurotoxins, they just don't know what they're talking about. They just don't. You have to understand that the part, if I told you if any other drug in the world, that of these 4 drugs, the part of the drug that works on the patient is exactly the same in all 4 patients, you'd say, oh, well, they must all work the same way. I mean, right? If the part that does the work is the same, how can they be different? And that's what I'm putting out to all of you guys. How can they be different?
Right.
I can't. When people say Botox is only for older women and their cosmetic needs. So that's my point. I mean, they're all good. They all work, right? But they work differently. So if you use the same neurotoxin on 10 different people, you're likely to get 10 different results. But that's about the person, right? It's not that the neurotoxin doesn't work. And if anyone says to you, when a neurotoxin works differently in the same patient, what's happening there? When you see so if you see a single neurotoxin work differently on the same patient, maybe I'm not understanding. When you see if neurotoxin works differently on the same patient, are you saying different neurotoxins work differently on the same patient? Is that what you're saying? Yeah. I'm saying that's partly on us. So with respect to the different neurotoxins, they're not the same in terms of how much neurotoxins contained within each bottle. Like, some have higher levels of neurotoxin than others. So some dosing is a little bit stronger in some neurotoxins than others, using the same amount. So that's, again, on us in terms of how we mix it and dilute it. So the part that does the work is the same, but the amount of neurotoxin in each bottle is different. And they're a little bit different biologically. So that's what's accounting for the differences. But what I was saying is, if you take the same neurotoxin, Botox, Dysport, whatever one, and use it on 10 different patients, you'll get a different onset of action. You'll get a different duration. You'll get a different, amount of paralysis of the muscles, because everyone's different. Some people have really big muscles, some people have really small muscles. In some patients you might have injected it more superficially, or others you might have injected it more deeply. Others might have rubbed it after you left and got, done something after you treated them to affect how it diffuses. There's 1,058,000 different potential variables that affect the onset, duration, and longevity of neurotoxin. So it's really more about individual variation, but in terms of the product itself, that doesn't change from patient to patient. It doesn't change from batch to batch. And if you look at the companies, the quality control portion of each company, some have better quality control than others. Some products, like the only company that really makes its own Botox, makes its own neurotoxin, and controls it from the beginning to the end, is Botox. The other companies, like one company's toxin is made in Korea, one company's toxin is made in Germany, one company's toxin is made in a different place, and they have no control over the manufacturing. They have no control over. But Allergan, which makes Botox, is the only company that oversees every single aspect of that neurotoxin production, to the point where it's like locked rooms, and it's a stealth agency if you ever try to get in there and get near it. So that there's a difference in terms of the companies. Like for example, Jeuveau. Jeuveau is basically a marketing or distribution company for the South Korean company that makes the neurotoxin, and has for many years. They don't manufacture it. They don't control it. They just market and sell it, and they make a profit. They have a licensing agreement with the product. So there's some quality control issues, but really we have to assume that their quality control is pretty good. So maybe there's some variation from bottle to bottle, but not with Botox. That's never happened. So I don't know how to explain it any better than that. So be careful with when people are talking about, how this one's better than that one, this one spreads more than that one, the onset of action is better. It's just really not true. It's really more about us and how we affect the neurotoxin that's in the bottle. How does it work? Well, it gets into the nerve, and these snare proteins are cleaved by the small portion of the nucleus. And when these neurotoxins do this, these snare proteins are necessary for the acetylcholine to get escorted to the end of the nerve and to be pushed into the neuromuscular junction to go across to the muscle. So they temporarily prevent the ACH from being released from the nerve. And with no ACH being released from the nerve, it's just like you cut the nerve. There's no nerve function, so the muscle kind of goes flaccid and becomes paralyzed. Because, could it be permanent or the long-term effects? Well, no, because your body starts regenerating new snare proteins, just like if you damaged any other protein. Let's say, you use some hyaluronidase and you destroy hyaluronic acid in a patient, which is protein. Your body makes more HA, just the same way your body makes more snare proteins. Now, some people have a higher rate of metabolism than others, so they might have a shorter downtime. Their Botox might not last as long. Some people have a sort of slower metabolism, and their snare proteins might take longer to come back. But also, the higher your dose of neurotoxin, the more snare proteins you cleave, so the longer it lasts. That's why I always say dose equals duration. The bigger your dose, up to a certain point, the longer your duration. So if someone says, that Botox you gave me last time didn't work. Well, it always works. But what they mean is it didn't last as long as maybe they thought it would or should, or maybe previously. It just means the dose was too low. It just means the dose is too low. If you just increase your dose, and it'll work better. So those are some things you can talk to patients about. Julie, what questions do you have as a sort of beginner? What can I answer for you?
Oh boy.
Have you had any problems with neurotoxin patients? Have you had any struggles?
No, I haven't actually started yet.
Oh, you haven't started? Okay.
No, I'm still waiting for clearance from MAA. So,
okay.
Yeah.
All right. Well, do you have to get signed off?
Yep.
Okay.
Yep. Coming up soon in May.
Let's do it. Get going.
Mm-hmm.
You got all this knowledge now and information, so you got to take it and move forward. But, everyone has these kinds of issues. Everyone has these kinds of patient issues and problems. And part of it is just that, people listen too much to stuff on the internet, and they don't really listen to the providers. The way they sort of they challenge providers sometimes with you're giving me too much or too little, or I want it here, and then people have come in with actual marks on their face as to where they want it without having any idea what they're even talking about, And so part of it is I appreciate your help here, but I've done this for 31 years, and I probably can figure this one out. But thank you. Anyway. Wait, I missed that. Come back with that. How much should I do what? I missed it. It was streaming too fast for me. Um,
Let's see. Oh,
can you see it?
no.
Oh, it just went. With the split screen, we can't see as many
All right.
questions, but just ask again. Yeah, so
Well,
they
I
listen to
am
social media instead of the experience. Yeah, yeah. Or they're maybe a graduate of YouTube University,
right.
and they know more than everybody. And yeah, I mean that's really the bad part about social media. Like stuff that people disseminate is often not true, and people that can't tell the difference between what's truth and what's not. And instead of listening to someone who's been doing it for a long time, they think that whatever they see on the internet is somehow true. Yeah, they listen to social media instead of the experience. So that our job is to, sort of say, well, let me explain to you really how much Zeman and Botox should I have on hand? Well, it depends how much you do, Dr. Lynn, who's a graduate of our Connecticut school. By the way, if you guys want to train with us, we've got a cadaver course coming up pretty soon. I'm not sure if it's in Connecticut or Massachusetts, but go to the link in our bio, check out our courses. You're welcome to train with us. And I think cadaver is a great place to start because we really do a very comprehensive training on that. Dr. Lynn, I think, was there. How much Zeman and Botox? Well, I don't know. I mean, it lasts a long time. It lasts for a couple of years in the fridge. So, buy 4 or 5 vials. Coming back in 2 weeks. Yeah, buy 4. I mean, listen, you can't have too much. And honestly, if you have it on your shelf, you're more likely to use it. And all the marketing companies know that if they can get you to buy it, it's good because they know you're going to use it. If you see it sitting there, you're going to use it. So, buy 5 vials, 500 units. How common really is Botox resistance? That's a good question. So, Botox resistance is kind of an interesting concept. Cadavers in Connecticut. So I'll see you guys there, whoever wants to join us. With these complexing proteins, they're proteins that you're injecting into a patient 3-4 times a year. And occasionally, patients can develop antibodies to those proteins. It rarely happens with the doses that we're using, but it often happens in patients who are getting, 3, 4, 5, 6, 700 units at a time. Kids with spastic hemiplegia or torticollis or some big muscle group. It's in the reconstructive medical side, really not the aesthetic side. But I'll talk about it anyway because even though it's less common, if you ever see it and you'll remember what I told you tonight, you'll know what to do. So this typically happens in a patient you've treated a number of times and had, normal results with and everything was great. And then one time they come back in and say, Dr. Russo, I don't know what happened, but the last time you treated me, it just didn't last as long as it normally does. Like normally I get 3.5 months out of it, but this time like 2.5, I noticed it start to wear off. And that's never happened before because as you know, with neurotoxin, when you treat someone over and over again, the muscle starts to atrophy from disuse, and you should need less and less neurotoxin in that particular muscle group as time goes on, not more, right? So it should actually last longer over time. So you're like, yeah, I don't know, that doesn't seem right. Like that's really unusual. Maybe I had a bad day. Maybe I misdosed it. Maybe. But let's just treat you again. We'll give you the same dose and see what happens. So then they come back the next time and go, oh my God, Dr. Russo, did you even give me any Botox? After like a month and a half, it was like gone. And that's like half the time. So right there, that's your first clue. The patient has developed antibodies to one of the complexing proteins from either Dysport, Jeuveau, or Botox. Not Zeman, because Zeman doesn't have any complexing protein. So the possibility of developing that resistance is zero. So what happens is as soon as you inject the Botox, your antibodies attack it because it's become sensitized. So just doing what your antibodies are supposed to do, right? Destroy the foreign protein. And so the Botox never really even has a chance to get into the nerve. So it just eats it up right away before it really gets in there. So if that happens, you either stop doing it or just change to a different neurotoxin. Maybe Zeman, since there are no complexing proteins, although the proteins from Botox are different than Dysport that are different than Jeuveau, so you could, technically not elicit that response. But I think in my case, I would probably just go right to Zeman because I know there's no complexing proteins where that can happen. But if that ever happens to you, where someone starts needing more and more neurotoxin for the same area, that's what's going on. It's rare. I mean, I see it. I used to see it once or twice a year. Now I would say I haven't seen it in a few years. And it's really, related to the dose. But as I said, if you're treating on the reconstructive side where you're treating these big muscles, right, you're doing 10 to 20 times the doses that we're doing, it's much more common in that group. Hi, Lulu. Very good information. Are you going to keep this competition open for when you? Yeah. I think it's a great idea. Does anyone have a really funny one, like a really funny thing? Because I have to give away a $50 gift card for the funniest one. But it has to be real. So I'll give you another minute to come up with a funny one before we sign off. And this is Jules, who's kind of like very new to the field. She's working very hard. She's getting ready to open up. She's going to get signed off in May. And she's going to have a bunch of patients lined up. And you're going to kill it.
In Connecticut.
In Connecticut. What town are you in?
We're opening in Putnam.
That's way up northwest,
Yeah.
isn't it?
Just under Webster.
Are there any people out there?
A few. There's more cows than people. Cows that need Botox.
You'll have the smoothest faced cows in the country. Kate, do you have any funny ones? I'd like to give you the gift certificate for you. Have you ever encountered someone who is allergic to neurotoxins? What does that even mean, Blaze? No. That is in the package insert. It says don't use this product if the patient has a previous allergy to Botox. I've never heard of it. I've never seen it. Obviously, it happens somewhere. So there are things in the neurotoxin. There's albumin. One of them has sucrose. One of them has lactose that are, to stabilize the proteins. Serum albumin. So I guess theoretically, if you have an incredible lactose intolerance or something like that, you could potentially have a reaction. But as I said, I personally have never heard of it. I've never seen anyone talk about it. But I think it's more related to that than the neurotoxin. I mean, I don't think you can be allergic to the neurotoxin, but I think you can be allergic to some of the stuff in the bottle, like lactose and stuff like that. Kyle's Beat Botox also lists congratulations. You're getting congratulations. When someone has hooded lids and you explain that they're hooded, then they complain about it after. The fact that you brought it up to them, yeah. Once you stop getting Botox, you'll look even older. Well, duh. I guess we're probably, I've heard so much that will affect my woman muscles during sex?
Yeah.
What? Kate, you get it. Are you making that up? My woman muscles? Like, I said, no, we're not injecting there. Kate gets the $50 gift card. Call my office tomorrow and say you got the funny line of the night award. Is that really true though, Kate? Is that really 100% true? Oscar, no, I believe you. I believe you 100%. I mean, that is it going to affect your woman parts and she won't be able to have sex. Okay. Well, I think that takes it for that. I think we can close up shop because no one's going to beat that one. Yeah, I believe you. She keeps talking. I believe you. Well, that's a new one. I'm gonna have to lead with that one next time because I was saying she has to sit up right for 4.
Oh my god.
Oh my god. You can tell these people anything. Don't lay down if you don't want your Botox to move. Kate the Envy. All right, Kate, you take the cake tonight. Thanks everybody for listening. And
all right.
Thanks for
good to be online with you.
Good. It was actually fun. It's actually more interesting. One of my patients called in and inquired about it, and she had to change her mind. I said, Botox kills people. Yeah, because it really does. Yeah, that's a great idea. That's why it's been around for 20 years and it has 1,500 gazillion treatments. It kills people. I think it's a little bit crazy. But anyway, it's been a lot of fun tonight. Good to talk to you, Jules. Let us come back on when you get going, and let's talk about how you're getting started and if there's we can do to help. All right? All right. Good night, everyone. See you next week. Bye.